Hello everyone, welcome to What's Made Easy. My name is Dr. Beston Wheeler, and today we're going to be discussing cervical cancer. So in depth, we're going to look at the pathophysiology, the relevant anatomy. We're going to look at the risk factors, the etiology, and the clinical manifestation. So this is the first part of the video, and if you would like to watch part 2 of the video, please do hit the like button, subscribe, and share for more interesting content on this particular channel. With that being said, let's go. So we're discussing cervical cancer today. So the first things first, what is cervical cancer? Okay, what is cervical cancer? So when we talk about cervical cancer, we are basically talking about the cancer that is affecting the cervix. So what is this cervix that we're talking about? So the cervix, this is the lower cylindrical distal portion of the uterus. Okay, so the cervix is the lower cylindrical distal portion of the uterus. Okay, and it is actually divided into two portions, and these two portions are actually named the endocervix and the ectocervix. Okay, so the cervix is the lower distal portion of the uterus, and it is divided into two parts. Okay, this organ is found in females. It is divided into two portions, and these are namely the endocervix and the ectocervix. So talking about the endocervix, so the endocervix is the inner canal of the cervix. Okay, so the cervix has got you have the internal and the external os. Okay, and then from the opening, okay, the external os is the one that is on the opening into the vagina. Okay, and that canal that leads to the uterus, that is what you call the endocervix, which is the inner canal. And this canal is lined by columnar epithelium that produces mucus. Okay, and then the ectocervix is the outer part of the cervix that projects into the vagina, and this is lined by what you call non-keratinized stratified squamous epithelium that is similar to the epithelium that you find in the vagina. Okay, and the area where this squamous epithelium transitions to columnar epithelium, where the ectocervix and the endocervix are meeting, is what we call the squamocolumnar junction. And why is this important? Okay, why is this important? We know that this squamocolumnar junction, okay, is going to be, as we're going to see very soon, it's going to be a very, very important, these are going to be very, very important landmarks that we're going to be using to know where the cervical cancer is coming from. Okay, so that is the squamocolumnar junctions. Okay, so just to show you a picture, okay, just show you a picture of what I'm talking about. So the cervix, you have a tubular portion. Let's say this is the uterus. Okay, so if this is the uterus, okay, you have the uterus. So the lower portion is the cervix. Okay, so let's say this is the cervix. Okay, it's the cervix, the lower portion, okay, of the uterus. So that is the uterus. So I say this is the uterus. Okay, I'll just put it as UT. So if this is the uterus, and then you have the lower portion right here, this is the cervix. Okay, so the cervix is divided into the endocervix. So this is the endocervix. You have the endocervix, and then you have the ectocervix. Okay, this one projects outwards like that, okay, onto the vagina. Okay, so that is the so this area, this is the ectocervix. Okay, so this is the ectocervix, and this is the endocervix. Here you have the external os of the cervix, and you have the internal os of the cervix. Okay, so that is what we're talking about. And when you look at this, we're saying the cervix is divided into the endocervix. So this is the endocervix, which is lining the cervical canal. So this is the endocervix, and then you have the ectocervix down there. So this endocervix is lined by columnar epithelium. Okay, it's lined by columnar epithelium like that. Okay, you have toe columnar epithelium. Okay, like that. okay? But the ectocervix is lined by stratified squamous epithelium, okay? So these are layers of squamous epithelium, which is non-keratinized, okay? And at the point at which this squamous epithelium is meeting with the columnar epithelium of the endocervix, so this point is what we call the squamocolumnar junction, okay? So that is what we're talking about here, okay? I hope we're able to follow that. I hope we're able to follow through. So now, talking about this, this is basically a picture showing you what I'm just from drawing. So this is the uterus, okay? You have the uterus right there, and then you have the cervix. So the inner lining, so this is the endocervix, and this part is the ectocervix, okay? If you look at the top part, I'm sure you're able to see my pointer. So this part is the ectocervix, and this endocervix is lined by columnar epithelium. I'm sure you're able to see the columnar epithelium there, and the ectocervix is lined by stratified squamous epithelium, which is non-keratinized. So this is the ectocervix. Okay, so this is squamous epithelium. As you can see, this is your external os of the cervix, okay, and this is the ectocervix. The point at which the endocervix and the ectocervix are meeting, this point right here, this point that is right here, is what you call the squamocolumnar junction, okay? So what you call the squamocolumnar junction. And I'm sure you're able to see even here, you can see it clearly. You have your columnar epithelium here in red. So this is the os of the cervix here, okay? You have the os of the cervix, and then you have columnar epithelium inside, okay? This is columnar epithelium in the endocervix. And then outwards, you have the ectocervix right here, which you can see, okay? That's the ectocervix. And the point at which they are meeting is what you call the squamocolumnar junction. So squamocolumnar junction is somewhere right there, okay, where you have a transition from this reddish color, okay, to this a little bit pale color. So that is what we're talking about. And yeah. So that's just your statistics. So now, what's the pathophysiology of cervical cancer? What is the pathophysiology? So the pathophysiology, so in children and girls before puberty, okay, in these children and girls before puberty, what happens is that the squamocolumnar junction is located within the endocervical canal. So within the endocervix, that is where the endocervical canal, that's where you find the squamocolumnar junction, okay? That's where you find this transition, okay? Such that the columnar epithelium during this period is not exposed to the acidic environment of the vagina, okay? So the vagina, so sorry for this isn't supposed to be cervix. So it's supposed to be the acidic environment of the vagina, such that this epithelium, the columnar epithelium, shouldn't be exposed to the acidic environment of the vagina. However, as the girl grows and reaches puberty, the cervix will continue to enlarge. So it enlarges due to hormonal influences, and then the endocervix everts. And when it everts, it moves this columnar epithelium, which means that this columnar epithelium is going to be moving, okay, towards the ectocervix. And once that happens, okay, this columnar epithelium now becomes exposed to the acidic environment of the vagina. Remember that the vagina has got normal flora, okay, which help in the production of acid, okay, which keeps an acidic environment in the vagina to try and prevent infections, okay? So once this columnar epithelium is exposed to this acid, okay, in trying to withstand the acidic environment of the vagina, okay, in trying to withstand this acidic environment of the vagina, this columnar epithelium will have to change to adapt, okay, by a process that we call metaplasia, okay? So this is where the columnar epithelium is going to be changing from columnar to squamous epithelium, and that process is called squamous metaplasia, okay? So that is what is going to be happening, okay? What are we saying? In children, okay, and girls before puberty, the squamocolumnar junction is located within the endocervix, within the endocervical canal. such that the columnar epithelium is not exposed to the environment of the vagina, which is acidic. However, when the child grows, as the child reaches puberty, the cervix continuously enlarges under the influence of hormones, even during pregnancy. Okay, this happens. And due to this enlargement, it pushes the columnar epithelium outwards towards the ectocervix. Okay, that is called ectropion. Okay, and because the columnar epithelium is not meant to withstand harsh environments like the acidic environment, it will have to adapt. That is cellular adaptation. So it's going to change from columnar epithelium to squamous epithelium, to stratified squamous epithelium, to be able to withstand that particular environment, that acidic environment. Okay, and that process is called squamous metaplasia. So what then happens if that happens? So this metaplasia that happens is going to lead, look at this. We had a squamocolumnar junction that was, that was there, okay? So we had this squamocolumnar junction, okay? Let me just show you. So we had this squamocolumnar junction that was right here, okay? This was our squamocolumnar junction. That was right here. And we have this columnar epithelium that is lining this. Now, as the cervix grows, this sort of starts to evade outwards. Okay, so it starts to evade outwards. So it starts to evade outwards, such that around this area probably you are going to find columnar epithelium instead of the normal squamous epithelium that was there. Okay, now this environment of the vagina is acidic, and therefore, to withstand the acidity, this columnar epithelium will have to change, okay? And it will change from this columnar epithelium to stratified squamous epithelium. And this process is what we're calling squamous metaplasia. Now, this is where our squamocolumnar junction was. And because this has been pushed outwards, you find that this particular area is going to be pushed maybe up to this point. Let's say it's pushed up to this point. Okay, so this means that you have columnar epithelium right here, and then you have squamous epithelium. Now, when this columnar epithelium is exposed to the acidic environment of the vagina, what will happen is that this columnar epithelium also changes into stratified squamous epithelium. Therefore, you are now going to have a new squamocolumnar junction forming somewhere there. Okay, which means the old squamocolumnar junction, the old squamocolumnar junction right here, okay, will be somewhere here, and this is where the metaplasia has taken place, and then you have a new squamocolumnar junction that has formed. And this area between the old squamocolumnar junction and the new squamocolumnar junction, so this area that is right here, this is the area that you call the transformation zone. Okay, so this is the transformation zone, or TZ, which is marked here, okay, which is from here up to somewhere there. So this is the new squamocolumnar junction that you have there, and you have the old squamocolumnar junction that has been pushed there. Remember, the old squamocolumnar junction initially was here, okay, but after growth has taken place, you find that it has been pushed somewhere here, which will be pushed somewhere. Let's say it's pushed somewhere around this area. Okay, let's say it's pushed somewhere around this area, and then you will have a new squamocolumnar junction that has formed, and the area in between this area is what we call the transformation zone. Okay, it's what we call the transformation zone. Okay, therefore the area that is between the old squamocolumnar junction and the new squamocolumnar junction is called the transformation zone. Why is this important? It's important because this area is where precancerous lesions that we call cervical intraepithelial neoplasm, okay, which is CIN, and the cervical cancer itself, this is the area in which greater than 90% of these cases will come from. So they'll arise from this area. Why this area? Because there's active cell division that is happening. There's a cellular adaptation that is taking place. You have a change from a columnar epithelium to stratified squamous epithelium. That multiplication, that change in cells predisposes it to cancer. And once it is infected by HPV, okay, human papilloma virus, okay, it increases the risk of this particular person, of this particular female, developing cervical cancer. So this transformation zone is actually susceptible to HPV infection, okay, making it a common site for cancer development. You should note that over time, the location of the squamocolumnar junction changes with age, it changes with pregnancy status, and also menopause. So the transformation zone also shifts. It's not just constant at one particular point. Okay. What's the causative agent of cervical cancer? The causative agent of cervical cancer is a virus that we call human papilloma virus. Okay, so there are different types. There are different types of the human papilloma virus, but cervical cancer is mainly caused by high risk types of human papilloma virus. The most common ones being human papilloma virus type 16 and type 18. Okay, the other human papilloma virus types that are important as well, very common, is the low risk types, which is 6 and 11. This is just a mention because these HPV 6 and 11 most commonly cause warts. That is a very important point for you to take. It's a very important point. It's examinable and it comes in your exams. So make sure you take note of that information. Okay, so the HPV viral genome has what you call oncoproteins. So these oncoproteins are called E6 and E7. So oncoprotein, remember that oncology is the study is a field of medicine that deals with cancer, isn't it? With cancer cases. So oncoprotein, we're basically talking about proteins that are responsible in cancerous transformation. So these are E6 and E7. And these oncoproteins, they cause inactivation of what you call tumor suppressor proteins, okay? Tumor suppressor genes, which transcribe into tumor suppressor proteins, okay? And you know that tumor suppressor proteins, these are responsible to make sure that cell division is controlled so that you don't end up with uncontrolled cell division, which will lead to a cancer, okay? And so, because these E6 and E7 are going to suppress these tumor suppressor proteins. And what are these tumor suppressor proteins? We have P53 and RB. So P53 and RB, those are the tumor suppressor proteins. And these are able to regulate cell division so that there's no uncontrolled cell division, so that there's no cancer. So now what happens if you inhibit the tumor suppressor proteins? Okay, what will happen is that cell division will be uncontrolled and you end up with a cancer. And that is how cervical cancer comes about. So E6 inhibits P53 and E7 inhibits RB. And because of this action, you end up with what you call cervical cancer. Okay, you end up with uncontrolled cell division, and that is going to lead to a cancer. And that type of cancer is found on the cervix, and so it is called cervical cancer. Okay, just a note, this is one of the most common cancers. Okay, it's one of the most common cancers in females that you are going to find, and it's a very big problem, especially in our country. We have a lot of women that are dying because of cervical cancer. And the good part is this is a preventable disease. This is a curable disease. Okay, that's why it's important for us to know how it comes about. It's important for us to know how it happens, so that we can educate the people out there. We can educate our communities. We can educate our mothers. Okay, so that we can try and lower and prevent these preventable deaths that are coming as a result of cervical cancer. Let's continue. How is HPV infection acquired? This is very important, because if you want to give out information to, you want to educate, okay, you want to give IEC to the communities, you want to give IEC to our mothers, okay, to parents, so that they can have their children protected from cervical cancer. It's important to know how HPV is acquired. So it's largely sexually transmitted. So HPV is largely sexually transmitted. Therefore, part of the causes, okay, part of the risk factors are going to be that of things that will predispose this particular patient into having contracting this sexually transmitted infection. Okay. So 80% of infections, however, so even when you get the HPV, human papillomavirus, 80% of these infections are eliminated by the immune system. Within 18 months, you eliminate about 80%. However, there are 20% that may persist. 20% of these cases may persist. And it's this persistent HPV infection that's problematic. This is the one that leads to cervical cancer. It's the one that leads to cancer development. What are the risk factors for persistent HPV infection? We have immunosuppressions, especially very common in our setup is HIV infection. So those that have HIV infections, most of them. Okay, so you have HIV infection is a big, very, very big risk factor for development of cervical cancer, because it will cause your immunity to fail to clear this HPV infection. So you develop a persistent HPV infection. So smoking is another risk factor. I should always know that smoking is almost a risk factor for a lot of cancers. Okay, nutritional deficiencies, okay, is also a risk factor. For example, deficiencies in in vitamin C. So all those deficiencies for people that, for example, don't eat enough vegetables, fruits, that those nutritional deficiencies are going to prevent you from clearing infections. Remember that when you are malnourished, almost all the arms of immunity are decreased. Okay, so there's decrease in almost all the arms of immunity, and that will make you predisposed to persistent HPV infection, because you fail to clear that out. And other unknown cofactors. Okay, so these increase the risk of developing CIN and cervical cancer. So what are the risk factors in a nutshell? We're talking about HIV infection, which is one of the biggest risk factors, especially in areas that have got high rates of HIV infection. You will find that mainly this cervical cancer is very, very common in areas that have got high rates of HIV infection. Okay, HIV infections. Okay, multiple sexual partners as well is a risk factor, because it increases the chances of this woman getting an infection, okay, contracting the HPV. Not using a condom is another risk factor, because this a condom would prevent, okay, this infection. Smoking, as we've said, multiple pregnancies, multiparity. Okay, multiparity is another risk factors, because you are going to have this repeated injury to the cervix, and that repeated injury will require repair, and because of that, that can easily lead to development of a cancer, and error can occur while trying to repair the injuries. Okay, early age at sexual debut. Remember that that we were talking. Remember what we talked about. We said that in the early years before puberty, the squamocolumnar junction is located in the endocervical canal, and as the lady reaches puberty, as this girl reaches puberty, okay, you have this cervix growing under the influence of hormones, and this is where now it is distends outside, okay, forming a new squamocolumnar junction and also the transformation zone. So this is the area at which in an early age of life, this is the area at which there's active metaplasia, and that therefore infection at that particular area with the HPV virus can easily lead to a cancer. Okay, low intake of fresh fruits and vegetables. Obviously, we've talked about this. You know that fruits and vegetables, these will boost your immunity. Okay, so there's what you call CIN, which is cervical intraepithelial neoplasm. So this is a pre-malignant lesion of cervical cancer that usually develops, and it involves abnormal epithelial proliferations and maturation of cells above the basement membrane. So before the basement membrane is breached, it's called a pre-malignant lesion, and this can be graded from CIN1 to CIN3. So what is CIN1? This is where you have involvement of the lower 1/3 of the epithelium above the basement membrane. CIN2, you have involvement, okay, of half, okay, to 2/3 of the epithelium above basement membrane. And CIN3 is where you have a full thickness of the epithelium above the basement membrane has been involved, okay, and this is what you call a carcinoma in situ. So this is what you call a carcinoma in situ. So this is basically what we're talking about. You have CIN1, okay, and you can see that It's just about 1/3, okay, from the basement membrane. This is the basement membrane. So you have, these are the cancerous cells, okay. This is your epithelium, basement membrane, and the cancerous cells. So the yellow part is the normal, and the blue part is the epithelium, the cancerous cells. So this is CIN1, and then as it involves more than half to 2/3, it is CIN2, and if it is involving the full thickness before it breaches the basement membrane, this is what you call CIN3. And when it breaches the basement membrane, it becomes an invasive cancer. It becomes cervical cancer. So it takes about 10 to 15 years from the time you acquire your HPV infection, okay, from the time that the HPV infection is acquired, up to the time that you develop full cancer. That's why age is not, okay, that's why age is not a risk factor. So age is not a risk factor for cervical cancer, because most women will be acquiring them through teenager. And if it will take 10 to 15 years for the cancer to develop, it means that that's why you are going to see most women coming in around their 35 to 40 years of age with cervical cancer. That doesn't put age as a risk factor of cervical cancer. What are the signs and symptoms? Okay, there's going to be postcoital bleeding. So this woman may come in, they will tell you to say they bleed after they have sexual intercourse, and this is as a result of contact bleeding. Okay, as a result of contact bleeding. This is one of the most specific features of cervical cancer that you get from patients. Okay, you who have they may come with intermenstrual bleeding. It may come in postmenopausal bleeding. Okay, the other symptom is persistent foul-smelling vaginal discharge. It may be there as well. They may have pelvic pain. They may have leg swelling or loss of urine or stool from the vagina, and this is because they can end up with a fistula that can form. Okay, they may have weight loss. Remember, this is a cancer, so obviously they may come in with weight loss. Okay, the symptoms related to metastasis. So if the cancer has spread to the lungs, they may have respiratory symptoms. Okay, if it spreads to the liver, they may have those symptoms. So there will be symptoms of the metastasis that has occurred as well. Okay, when you examine, you perform a pelvic examinations. What are the findings? So the lesion on the cervix can either be ulcerative. When you look at it, it can be infiltrative, or it can be exophytic. What we mean by exophytic, we mean that this is a lesion that is growing outwards. Okay, and as you examine, there will be contact bleeding. Okay, the cervix is friable and bleeds easily. Okay, so there may be a cervical serous, it may be a prurient or bloody discharge. And it's important for you to note that the most common cause of death in cervical cancer patients is renal failure. Okay, so this is a very common question in your exams. So renal failure is the most common cause of death. So this renal failure will cause uremia. How does it come about? Because as your cancer spreads, it may reach the pelvic wall. As it reaches the pelvic walls, it will obstruct the ureters, and therefore it is going to cause hydronephrosis, and renal failure, which will lead to uremia. Okay, so renal failure happens mostly due to ureteric obstruction. Other common causes of death would include anemia and infection. So those are the most common causes of death as a result of cervical cancer. So this is just a picture that is showing you a lesion that you can see. This is the cervix, and this is an ulcerative lesion, okay, on the cervix. And when you look at this, this is an exophytic lesion, okay, where it's growing outwards. Okay, it's the cervix, you have growth on the cervix. This is an exophytic lesion, okay, and this is an infiltrative. You can see that the entire cervix has been infiltrated by this lesion. So this is an infiltrative and exophytic lesion at the same time of cervical cancer. So thank you very much for your attention. I hope you enjoyed the video. For part 2 of cervical cancer, where we're going to look at the staging of cervical cancer, we're going to look at the management of cervical cancer, which will include the investigations, okay, the prevention, primary prevention, secondary prevention, okay, where we'll look at screening and screening methods, and the treatment of cervical cancer. If you don't want to miss on that interesting part of this video, please hit the like button, subscribe, and share for more content. Until next time, thank you very much, and God bless you. This is What's Made Easy. Stay tuned.